Good morning, ladies and gentlemen. Thank you, Sri Lanka College of Microbiologists, the President, Dr. Rohini Varnambi, Secretary, Dr. Normal Jayavardena, for inviting me to be a part of the 32nd scientific session. I'm honored. Dr. Nilesh Fernandapalli gave an excellent presentation on gut microbiome in health and disease. I bet Professor Anil Jayavardena will also give us an equally exciting presentation on nutrition and gut microbiome. So I'm sandwiched in between those two gut microbiome presentation to talk about probiotics for the next 10 to 15 minutes. So the agenda is I'm going to talk about the definitions of probiotic, prebiotics, synbiotics, and probiotics, some practical considerations, indications for probiotics and GI diseases, safety issues, future probiotics, and then a conclusion. So definition. So Nilesh has already touched base with this probiotic definition and prebiotics he mentioned, synbiotics, pharmabiotics, something new. So what is pharmabiotics? So the probiotics is supposed to give the health benefits through some soluble factors secreted by them. So why not we extract those soluble factors, purify and market it as pharmabiotics so that we are not exposing the patients for a live or with a live risk of live organism. That's the base of pharmabiotics. That is going to be replacing the probiotics in the future. Some practical considerations. To start with, the common bacteria are lactobacillus and bifidobacterium species used for probiotics. Not all probiotics are right for all diseases. That's very important. There are different probiotic strain possess unique properties for benefits of different diseases. The two important points. The second one is benefit offered by the probiotics are likely to be modest. They are not very dramatic, and thus probiotic therapies may best be used to supplement rather than replace the conventional therapies. That's very important. Number three rather, probiotics are considered dietary supplements. So they are not regulated by FDA in the United States, of course, in other countries by their regulatory authority bodies. So as such, the quality, the purity, and viability can vary from product to product. So let's get on to this, the GI conditions where probiotics can play a role. Again, Nilesh has touched some topics, but let me go over this very quickly. The acute diarrhea, there is not enough data to support the use of probiotics to prevent, I emphasize, prevent acute infection diarrhea. For instance, you are traveling some exotic places and you're worried about traveler diarrhea, and may not be a good idea to take probiotics to prevent, according to the studies, but the data supporting treatment of this diarrhea with probiotics are stronger. Coming to the antibiotic associated diarrhea, both in the pediatric and adult population, probiotics appear to be effective in limiting the severity and the duration of illness. Clostridium toxin related diarrhea, Nilesh talked a good amount of information he gave. The current society guidelines and expert panels state that existing data are not sufficient to justify probiotics for preventing primary or recurrent seriotoxin-related diarrhea, even though in practice we use probiotics very generously in seriotoxin-related diarrhea. Then hepatic encephalopathy. Well, lactulose is a mainstay of therapy for decades and decades. It's a prebiotic. So remember, prebiotic is the food for probiotic. And in this case, is a prebiotic for lactobacilli, which can limit bacterial ureases and thereby reduce ammonia and other toxin products. However, again, society guidelines and expert panels do not currently recommend probiotic use for any chronic liver diseases associated condition like even SPP. The next is IBD. IBD, I don't think is common in Sri Lanka, but to make it very short, in Crohn's disease, there is no data to suggest that this probiotics is helpful, but in ulcerative colitis, yes, it is. Around the IBS and SIBO, there is small intestinal bacterial overgrowth. Both have kind of similar concept in terms of etiology. IBS patients may have subtle differences in their luminal and mucosal microbiota compared to controls. Similarly, the small intestinal bacterial overgrowth has been reported in a proportion of IBS patients. So with probiotics, patients might experience a global improvement in symptomatology rather than a specific improvement in bowel function. Since the treatment options for IBS remains limited in both number and efficacy, a therapeutic trial of probiotics is reasonable for patients interested in this approach, or the patient who believe in this approach. So side effect safety issues and probiotics. The good news is most of the studies have shown that probiotics are safe, hardly any serious side effects. Gas, bloating, sometimes patient complain, but generally is well tolerated. So from my perspective, the number one side effect is financial toxicity. You wonder what it is. That's my invention. You won't find it in a medical textbook. So what is financial toxicity? Basically, you are draining the money through wallet for no reason. Again, the issue is, like I mentioned, it is not regulated by FDA or regulatory authority bodies in other countries. So the pharma companies which produce these probiotics, they can come out with very well, what do you call, just they hype uh, the, the effects of probiotics in a magnified way. It can do this, it can do that, and they reach out to social media nowadays, and there is no reason for a prescription by the doctor. So it's from social media to the consumers to the drugstore, and people buy and spend a lot of money on probiotics, excessive money on probiotics, and you just drain the money, your finance for no reason. That's called financial toxicity. That's my own language. Like I said earlier, there's not much of a serious side effects from probiotics, but bacteremia has been reported in severely ill patients or significantly immunocompromised ones. Endocarditis have been reported, and there's one Dutch study. It's interesting. They took acute pancreatitis patients and did a double-blind placebo-controlled study. It's a Dutch study, and I don't know why to begin with they use these probiotics for acute pancreatitis sick patients. Anyway, the bottom line is the patients who took probiotics died more often than the controls. So they developed mesenteric ischemia and died. Like I said, I'm not sure why they use this in acute situation or rather severe real patients. So they did the study, they killed some patients and then told us, oh, by the way, probiotics can kill the patient when it's used in a significantly compromised sick patients. Those are the side effects. And next, go to the next slide. I'm sure Dr. Ronald Javadna is going to touch on this probiotic-rich food. I'm not going to go into detail, but mushrooms, yeast, olive, and fermented cabbage, vinegars, fermented dairy products like cheese, buttermilk, and cucumber pickles. There's some, but I'm sure Dr. Javadna will touch more. So how do these probiotics, what do they do to us to confer spectrum of health benefits? So this is kind of basic bird's eye view. So prebiotics, like I said, is a food for the probiotics. So inulin and fructans are the common one. So it goes to the gut microbiota. So bifidobacteria and then lactobacillus are the common organism there. So the probiotics, so they break down the prebiotics. So fermentation of end products, which are short chain fatty acids, the acetic acid, propanoic acid, and butyric acid. So the pH drops. So with the pH drop and with the all the short chain fatty acids, there's some very good systemic effects on the body, and also some good effects in the colon, giving all the benefits to the body. This one was shared by one of my good friend at NIH. He's a big time believer in probiotics. So you can see this phenomenal thing, what Nilesh Fernandopoulos mentioned a lot, starting from the top to bottom. So if you look at the nervous system, there's increased general cognition, dementia process goes down, recall, memory goes up, learning is good, mood becomes better, the nervous system in infant develop, etc., and even autism. Then goes the cardiovascular system, the probiotic decreases the triglyceride, decrease the lipid profile and total cholesterol goes down, etc., etc. And then you go to the immune system, the antibody response towards the vaccine gets better, the immunological response is better, then calcium absorption is better on the bones, and the probiotics makes the skin glowing. It looks like collagen formation goes up, keratin retention is better, water retention is better, erythema goes down, the risk of atopic dermatitis gets better. It looks so impressive, right? I don't think so. Well, the effects may be there. I'm not saying this wrong, but I don't think there's a sizable or appreciable thing. So you got to be careful when you look at those slides or the studies. I don't think it is going to be very impressive, but certainly probiotics do have some good effects. So future, what is future? The technical advances in genomics are helping the scientific investigation of human microbiome and functional capacities of probiotics. So what are those? I mentioned about the pharmabiotics, so I just put it in a nice way. You can read it. The identification, purification, and repackaging of probiotic-derived soluble factors. They're going to be the future if they can make it. Then one example of how the lactobacillus can help in radiation enteritis is that it gives some epithelial cytoprotection. So in intra-abdominal malignancy, and when you give radiation therapy, the limiting factor for the radiation dose is the damage on the small bowel wall or the mucosa rather. So the lactobacillus gives some cytoprotection, so you can increase the radiation dose and make the effect on the cancer better. Then the future indication therapeutic directions for probiotics may include conditions as diverse as mood disorders, obesity, autism, and diabetes. Conclusion. So evidence support the role of considering the recommendation of conventional probiotics for some clinical conditions. Probiotic strain selection should focus on quality tested products with clinically demonstrated benefit for the given disorder. My take home message to you, even if you did not follow the previous slides, we, the patients and physicians, should expect only modest effect. That's number one. Do not expect a dramatic and very impressive effect overnight. And you should take it for a long time to see some effect. Number two, consider using probiotics as a supplement, as an adjuvant therapy, rather than a replacement for conventional therapy. So that's my kind of small talk to you all this morning. So interestingly, this morning, yesterday, the young, beautiful, charming lady in the IT department, Lakshika, she helped me to go with the PowerPoint presentation. I asked some naive questions, and she might have thought, oh my God, this doctor is a real Dumbo, doesn't know anything about IT. Just to prove that I'm not totally Dumbo in IT, and I do have some interest in IT and some knowledge. I'm giving you my next slide. This is my baby, and it has all the IT applications, and you tell what to do, and it'll do. Simple as that. If you've seen the Tamil movie, Rajinikanth's Tamil movie, Indran 2, you would have seen Rajinikanth driving this car in that movie. And we thank you and appreciate. I hope I made everything on time. And once again, thank you so much. And hope to see you next time in person.